यस सर, आ रही है।
आ रही है।
यस सर, आ रही है, आ रही है।
क्या हुआ बोलो ना। हाँ 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 हाँ, कर रहे। अभी आ रहा है शेयर करना.
Haris, can you hear me?
Yes, ma'am, you're audible.
Hello,
Yes, ma'am, you're audible.
am I audible? हा. चालेल मग आता ह्याला बसून ठेवू का? अच्छा मग हे आपण ठेवतो मी. फक्त आता हे मागचं आपल्याला चेक करायचं.
मैम वीडियो प्ले करना है कॉलेज का कि बाद में?
नहीं नहीं, कॉलेज का वीडियो प्ले कर दीजिए.
तो ये फ्लायर हटाना पड़ेगा फिर कॉलेज का वीडियो प्ले
नहीं फिर अभी एक काम करो आप. अभी कितने 27 हुए ना?
जी मैम.
हाँ तो एक 50 का आप ये कर दो. एक्चुअली
Okay.
अभी वी आर गेटिंग लेट. अभी
Yes.
वीडियो प्ले करने की भी जरूरत नहीं है अभी.
सर वहाँ पे वेट कर रहे होंगे.
Sir is waiting.
Yes.
And Dr. Suhit has also joined, I think.
तो वहाँ पे प्ले नहीं करते, डायरेक्टली स्टार्ट करते.
Directly, yeah, we started directly.
ओके ओके.
मुझे आवाज क्यों नहीं आ रही? तो वो प्रेजेंटिंग तभी आने वाला था। प्रेजेंटिंग किया।
A very good morning to one and all. We are waiting for the chief guest of today's function, Dr. P. A. Namdar sir. He'll be on board with us shortly. So kindly bear with us and be with us on the board. Thank you.
Dear particip आवाज आ रहा है? Dear participants, greetings from Allana College of Pharmacy. The chief guest for today's event is the president of MC Society, Azam Campus, Pune, Dr. P.A. Inamdar, sir. Sir will be shortly joining us. So may I request all of you to please greet us.
कितने बजे थी मीटिंग? इनके लोग कोई आए कि नहीं वहां से?
Good morning, all of you. The chief guest has joined us on the board.
Extremely sorry because I am attending almost per minute one meeting.
No,
It's
sir, it's
absolutely
our
all right.
Yes.
Sir, simultaneously the YouTube streaming is also going on.
Yes.
Yes.
A very good
Are you
morning
still-
to
Yeah.
A very good morning to one and all. I am Mrs. Areed Siddiqui, Assistant Professor, MC Society, Allana College of Pharmacy. Welcome all the dignitaries, chief guest of today's function, Dr. P.A. Namdar sir, President MC Society. Today's speaker, Dr. Suhit Gilda sir. Guest of honors and office bearers, Mrs. Abida Inamdar, Vice President MC Society. Dr. Latif Makhdoom, Honorary Secretary MC Society. Professor Irfan Sheikh, Joint Secretary MC Society. Professor Muzaffar Sheikh, Treasurer MC Society, all the principal delegates and students from various colleges. A hearty welcome to one and all to today's event. To brief about today's function and welcome the guest, I request our principal, Dr. Kiran Gise ma'am, to deliver the welcome address. Over to you, ma'am.
Thank you, Mrs. Ariz, madam. Good morning, all of you. Honorable Chief Guest of today's event and President MC Society, Dr. P.A. Namdar sir, Dr. Suhit Gilda, Managing Director, Dr. Gilda's Nutrition Satara, guests of honor and office bearers of MC Society, Mrs. Abida Inamdar Madam, Dr. Latif Makhdoom sir, Professor Irfan Sheikh, and Professor Muzaffar Sheikh sir, dignitaries and delegates on the board. On behalf of MC Society's Allana College of Pharmacy, Pune, I welcome you all at one-day workshop that has been arranged under the Entrepreneurship Development Program on the topic Nutraceuticals, a Paradigmatic Shift. The Maharashtra Cosmopolitan Education Society, Pune, that was established in 1948, has set an example for all the minority institutes in the country with its nationwide recognition for the excellence in the education. The MC Society is one of the oldest educational organizations of Pune that has done pioneering work in the field of education. The girls' education, especially from the weaker section of the society, is promoted strongly in our Azam campus so as to make them financially independent and enable them to stand on their own feet. As you all know that the studies, they show that when a woman eats healthy, everyone in her household is more likely to eat healthy. Therefore, it is worldwide recognized that diet and the lifestyle are essential to promote and maintain well-being and nice-being condition of everyone in the family. And therefore, it prevents the possible oncoming diseases, the onset of such diseases. The non-correct dietary habit and the lifestyle can in fact determine the pathological conditions of a person. Therefore, the prevention is the key strategy for an effective proactive medicine in which the efforts are addressed to prevent the different diseases and to lower the risk conditions associated with the wrong lifestyles. The nutraceuticals used in prevention of the diseases, and they are the tool to the good health condition. They can be effectively used by including in the daily diet in an area that shades in the range of beyond the diet before the drug, because they combine both nutritional and the beneficial healthy properties of the food and the food extracts that heals the different diseases. Dr. P.A. Namdar sir has always encouraged us to inculcate the vision of entrepreneurship amongst our students. Sir, we are really fortunate to have you with us. You'll be guiding us, our students, our delegates. We're also fortunate to have with us a young dynamic entrepreneur with us Dr. Suhit, who has agreed to share his knowledge and experiences with us. We hope that this session will be really helpful for all the aspirants who wish to enter into the startups related to the nutraceuticals. Once again, I welcome you all. Over to Mrs. Aries, madam.
Thank you, ma'am. I would now like to take this opportunity to introduce you all to chief guest of today's seminar, Dr. P.A. Nanda. Sir is President, MC Society, Pune, President, Maharashtra Medical Education and Research Center, Pune, Member, Planning Commission of India and Higher Education, Executive Vice President, Maulana Azad Foundation. Sir is an excellent orator, a philanthropist by nature, working tirelessly and generously for establishment of educational institutes across India. He is known for his generous contribution in upliftment of minority, poor and deserving students at Azam campus, supporting various institutions. With this, I would now request Sir to take over and enlighten us with your words of wisdom. Over to you, Sir.
Dr. Gilda, Madam Bise, her all colleagues who are here and who are not here, but they are supporting the organization, and those who are attending this webinar. My philosophy is very simple. I am keeping my heads busy, and in turn they are keeping all their subordinates busy, and in turn the subordinates are keeping students busy, and students are keeping parents busy. And I always believe once you are busy, your priorities are different. And if you are not busy, your priorities are different. And this is exactly what we are supposed to do when we are listening to Dr. Gilda, because he has decided at a very young age what he is exactly supposed to do, and nothing is easy. Everybody has to struggle for it. But to make name, that too also in Satara, is not that easy. Because in bigger cities, nobody bothers who is who. In a smaller cities, everybody is supporting in such a manner so that he should not be progressing. These are all things which one must understand while listening to him. Because Madam Bise is trying to keep everybody busy by trying to share knowledge from and with whom the knowledge is already there. And because of that, I think our college has name and fame, not in Maharashtra, elsewhere also. But at the same time, the students passing from our institution, maybe any institution, because we have about 32 institutions in the campus with 27,000 students in the campus. 14,000 are from poor slum dwellers, but doing amazing jobs, amazing technology-based teaching and learning. I therefore, without taking much time, I wish all of you that the intention with which Madam Bise is holding this webinar, so that should be useful, particularly to the teaching staff as well as also for the students and others who are participating. I may like to announce here, if you want to be an entrepreneur, I am prepared to invest. कोई प्रोजेक्ट लेकर आइए, मैं इन्वेस्टमेंट करने के लिए तैयार हूं, क्योंकि बैंक में भी रिटर्न्स कम आते हैं. तो अगर बैंक में रिटर्न्स कम आते हैं और मेरे कैंपस के बच्चे अगर पैसे कमाना चाहते हैं, सिर्फ उनकी रिक्वायरमेंट पैसे नहीं है, ये है, मगर ऑनेस्ट है, हार्ड वर्किंग है, समथिंग न्यू हैज कम टू देम, in that case I'm not joking here, I'm very serious. The reason is supporting youngster is a pleasure. पैसे आते रहेंगे, जाते रहेंगे, लेकिन हमारे वजह से अगर 10-20 लोगों को ऐसा लगे कि ये अगर नहीं होते तो शायद हम यहाँ तक नहीं पहुंचे होते, तो मुझे लगता है कि इस तरीके के कॉन्फिडेंट लोग, and those who are really confident in their knowledge and also their success, 99% they don't do this. 1% people are there where there is a gap. 99% तक आते हैं, फिर लगता है कि नुकसान होगा तो बिल्कुल रिवर्स गियर में जाते हैं. 1% लोग ऐसे होते हैं, नो वो नुकसान नहीं होगा क्योंकि मैं रात और दिन काम करूंगा, मैं मेहनत करूंगा, ये गैप मैं आने नहीं दूंगा और मैं सक्सेसफुल होऊंगा. ये कैंडिडेट मेरे कैंडिडेट, including Dr. Gilda. If you want some type of a partnership with me, I am prepared to share that partnership. I congratulate Dr. Gilda for coming to this level at this age and also undisputed. And such a person is here. I must also appreciate, madam, this is from where she locates, I don't know. But every time some very good person comes here, his experience, knowledge, and also some sort of a positive attitude, that knowledge is developed among our students and teachers. This is what is required in India. And here, if you see, everybody is present. This is my India, this is your India. And that India must prosper, and we have everything at our disposal to do that. And therefore, this seminar, I wish all of you a successful seminar. You should get more and more knowledge, and all my teaching staff should understand, keep others busy. घर में भी सबको बिजी रखो, आपको तकलीफ नहीं होगी. समझे कि नहीं? घर में भी, घर वाली की बात कर रहा हूँ. तो ये भी हम क्यों करते हैं कि सब बिजी रहे तो प्रायोरिटीज चेंज होते हैं, और उसके मुताबिक वेबिनार के जरिए हम सारे लोगों के प्रायोरिटीज को चेंज कर सकें. बेस्ट ऑफ लक. थैंक यू.
Thank you, sir. You're truly a living legend, and thank you for always being a shield, inspiration, and support. With this, I would now request Mrs. Asma Mukashi, ma'am, to introduce today's speaker. Over to you, ma'am.
Yes, thank you, Arish, ma'am. It gives me an immense pleasure to introduce the resource person of today's webinar, Dr. Suhit Shirish Gilda. Dr. Suhit Gilda is Managing Director at Dr. Gilda's Nutrition, a nutraceutical company located at Satara. Dr. Gilda's Nutrition is involved in the manufacturing of dietary supplement, Ayurvedic and the herbal formulation, as well as the cosmetics and the personal care products. Coming to Dr. Gilda's academic credential and the research, Dr. Gilda has completed his PhD in Faculty of Pharmacy from Bharati Vidyapit Deemed University, Pune College of Pharmacy, Pune. During his PhD program, he has grabbed the National Doctorate Fellowship by All India Council of Technical Education, Government of India, and thus worked as Senior Research Fellow in Department of Pharmaceutics at Bharati Vidyapit Deemed University. Sir has completed his M.Pharm from the same institute in the Department of Quality Assurance Techniques, that is Pune College of Pharmacy, Pune. During his M.Pharm program, Sir has qualified the GATE and received the Junior Research Fellowship from the AICT and worked as the Junior Research Fellow during his M.Pharm course. Sir has completed his B Pharmacy from Satara College of Pharmacy, Satara. Sir has also completed a Diploma in Intellectual Property Law from World Intellectual Property Organization from foreign country, that is Geneva. Sir is Knowledge Transfer Partnership Associate at University of Bradford. Sir's scholastic achievements include the awards, many awards, such as he is the recipient of Maheshwari Ratna Special Critics Award in 2013 for excellence in the field of science. He has awarded with Mahesh Idol in 2019. Sir is the recipient of Dr. APJ Abdul Kalam Lifetime Achievement National Award in 2019 by International Institute for Social and Economic Reforms. He has also received Me Padvidar Award in 2019. Sir's research in the area of development of natural products is not only for the academic or purpose, but he has owned the 5 patents through its research on his credit. Sir has 21 international publications and presented 4 posters in the international conferences. He has the professional membership of registered pharmacist in Maharashtra State Pharmacy Council, India. He is not only the entrepreneur, but he is a very good academician. He has guided 16 PG pharma students for their research projects and Currently, he is registered PhD supervisor at Dr. Babasaheb Ambedkar Technological University, Loneer. As Sir is working as associate professor in Gauri Shankar Education Society, Satara College of Pharmacy, and his teaching experience is of 10 years. With this brief introduction, I request our speaker, Dr. Suhit Gilda, to kindly share his knowledge and guide us on the topic of industry formation. Over to Dr. Suhit Gilda, sir. So please.
So, good afternoon, everyone. So, am I audible?
Yes, sir. Yes, you are audible.
Okay, thank you very much. So, getting the appreciation words from the visionary leader, so Dr. Inanda sir. So, it's a really great feeling here, sir. So, to have such words from you. And thank you very much, Bisa ma'am, Mokashi ma'am, and all the Allana College faculty members for giving me the opportunity to share some thought process, so which was going through for last say about 30 years. So my age is 38 years, but I'm saying the thought process is from the 30 years because I am grown up in a family where my father is an engineer and my uncle is a Ayurvedacharya. So I am grown up with playing with medicines only. So I am not having anything to play with other than the jadi booty, or say the churna, or say the some pills, or say chavanprash preparations and all the stuff. So with this thought, I just preparing for the today's talk. And I was just thinking about, so let's just start with the entrepreneurship. And as the topic, it was the entrepreneurship, the topic was decided, or the topic was introduced by the entrepreneurship self-development. So I just thought we will talk about the entrepreneurship because right now we are in the era of really a knowledge evolution, because we are not in the leadership of authoritative leaderships. In some areas, still it is there, like armed forces, all the stuff. But nowadays, realistic requirement is about the really, it is about the entrepreneur leadership, where it is like about the teaching, guiding, and coaching is required for ourselves only. So I will start sharing my presentation. Please confirm it that it is getting displayed properly or not. So it is visible to all. So is it visible to all?
No, sir, it's not visible.
So now it is. Is it visible right now?
No, sir.
I think so. It's not visible.
Yes.
Yes. So, so thanks for the nice introduction given by ma'am. So it's about the nutraceuticals, a paradigm shift, and myself, Dr. Suhit Gilda. So one more thing that I want to share with you. The first thing is about the disclaimer. So I will go quickly through the disclaimer. So presented views are scientifically tested and tried by the presenter. So we do respect the views presented by the others. We do not have intention to challenge, disrespect any views, claims, opinions, concepts presented in any form by any person, firm, or company. Presenter agrees variation in individuals by nature, genes, and economical status. Some of the content is directly taken from the official websites for the sake of understanding, and aforesaid presentation is merely for understanding of the students, and it does not have any commercial intention or use. Okay, so when we are talking about the entrepreneurship. So I just thought, so I will come up with entrepreneurship toolkit. So when we are talking about the entrepreneurship, so I would like to add entrepreneurial skill set. So when we are talking about entrepreneur is not someone who left the job and start pursuing his passion. I'm not talking about that personality. So I am an entrepreneur. I go to the institute 9 to 5, and I have my own company, or say I have my own enterprise where I do try to satisfy my passion. So when we are trying to find it out, what exactly the entrepreneurship, it's not about the giving up a job and starting up an enterprise. It's all about the entrepreneur spirit. Really, it is the element that is in the world of future. It is required. Why it is required? Because it is a day-to-day basis what we are observing right now. The tools or the frameworks which were used for the management of any business or managerial skills, what we thought to have or what we thought to get from the esteemed institutes are from the 90s or from the 2000. But nowadays, it is a totally paradigm shift that we have to develop new toolkits, new skill sets to run an enterprise. It's not by the thing that it is like typically when we are talking about its authoritative leaderships, where we are getting into the industry and we are starting with some manufacturing work. And after some years, when the hairs are getting grayed or someone with the bald hairs, after say 50s and you are at the managerial position, it's not about the thing right now. So we have to change. We have to shift our thought process from that authority leadership to something else. What that exactly is, we will talk about. So when we were going by the nutraceutical field and rightly by the Charak Sanhita, it is given in the text, which we always try to find out in the Ayurvedic text, which is the physical body is the product of diet and sensory input. That is the lifestyle what we are trying to, and it is given also pointed out by the Bisa ma'am in her speech. Similarly, all diseases are the result of non-correct diet and lifestyle. Diet and lifestyle, wholesome and unwholesome, are the foundations of health and illness. So it is there in our ancient text also that we have to go with the proper diet and proper lifestyle in order to have proper health. And when I'm talking about the health, it is in all the dimensions. It is not about only the physical health. I'm talking about all the dimensions of health. Okay, so the let food be your medicine. So I'm basically a registered dietitian, and whenever some clients come to us to have a diet plan, I ask them why you are feeling that you must have.
Hello, Dr. Suhit.
Yes, ma'am.
May I request you to make your presentation full screen?
Already it is, ma'am, full screen, but
Slideshow. Full screen, that is slideshow.
Is it in the full screen right now?
Sir, actually we can see your full screen, but the thing is that we can see the two screens. One screen ahead and another screen is there backside.
Your images. Now we can see only one screen. And can you please make it slideshow?
Okay, ma'am. Just a minute.
Excuse me, sir.
Yes.
So please press F5. F5.
So is it okay? So
Please make it, now the images are splitting somehow.
So it is okay right now?
We can see two screens.
No issue, madam. Let him
Okay, sir. Please continue.
Okay. So as we are thinking about, let food be your medicine, and when some clients come to me and ask for a diet plan, so I ask them why you want to have a diet plan for your health. So they are saying they are having a different lifestyle, a different what they want to have, a different personality within 1 month or something like that. So I just ask them, are you focusing on some pills or some medicines that will cure your diseases? Oh yes, they say yes, we want to have such pills or something else so that we will be healthy. I said, don't be. So let food be your medicine. And it is rightly pointed out from the Greek physician Hippocrates, say 5,000 years ago. So what exactly our philosophy is, the focus on prevention. Some basic terms what we will go through, and before that I will like to share a Sufi story, because I always try to put it all the things in a storytelling manner, and I will try to have the Sufi and I will take a freedom to speak in Hindi. Is it okay, ma'am? Hello.
Yes, no problem, Dr. Suhit. Please.
Okay. So it is a story about desert, and that desert, एक आदमी वहां पे लेटा हुआ था, वो बहुत थका हुआ था, and he was sleeping exactly under a tree, and इतना वो गहरी नींद में था कि उसका मुंह खुला हुआ था. So after some time, एक छोटा सा सांप उसके मुंह में जाने के लिए जा रहा था एक्चुअली. सो वहीं से एक पर्सन वाज गोइंग ऑन हॉर्स, उसने वो देखा, उसने वहां से मतलब घोड़े पे से उतरा, एंड उसने हाथ में जो उसके जो चाबुक था उससे वो उसको पीटने लगा. ही वाज ट्राइंग टू वेक हिम अप. थोड़ी दूर से एक टीले पे एक पर्सन खड़ा था, एंड ही वाज जस्ट ऑब्जर्विंग व्हाट एग्जैक्टली गोइंग ऑन. उसको ये दिख रहा था कि ये एक बंदा दूसरे पर्सन को बहुत बुरी तरह से पीट रहा था. सो व्हाट दैट एग्जैक्टली इज अबाउट द पर्सन looking at, and how you are giving your thought process. वो पर्सन था जो उसे उठा रहा था ताकि उसके मुंह से वो सांप मतलब निकल के बाहर आ जाए, या वो पर्सन मतलब जग जाए. But on the other hand, what the person on the somewhat place, उसे वो लग रहा था कि वो पर्सन उसे मार रहा है. That was the difference, and that is about the perception and the perspective what we are always having when we are dealing with the entrepreneurship, and basically the nutraceuticals is about. The second story, when we are trying to find out, so since एक साल हो गया है just what we are having the first case of our COVID-19, so maybe in the Wuhan, and we have experienced what exactly the pandemic it has brought to the world. So from that COVID-19 pandemic, so each and everyone has got an idea about vitamin C, it's the doses, vitamin D, zinc, and all the stuffs. You can't imagine suddenly the market share of the multivitamins, or say vitamin C, which was previously it was around 0.001%, directly shifted to the 2% of the total market share when we are comparing. So unpredictability is basically, if we are talking about, this is the only case in India where we are having so lots of death, but it is not the case with the India only. So we have experience, or what we have thought about, or we have seen in the news also, that the Italy or say the US, the total death cases are more than that we are experienced, or what we have seen in India. Why? We admire the US FDA, because they are having the stringent pharmaceuticals or the nutraceuticals or some food related norms in the world, but still they are having the most death cases. Again, when we are dealing with the nutritional applications or nutritional values, and when we are talking about the India, we are facing malnutrition as a major problem when we are dealing with the school children, or say the underprivileged children, when we are thinking about the nutrition. But in case of US, they are also having the same malnutrition, but it is only and only due to the unfocused malnutrition or the nutrition point of view. They are having improper justice to the food. So when we are thinking about, so this is the paradigm shift what we are trying to address today. So when we are thinking about the nutraceuticals, the term nutraceutical was coined from the nutrition and the pharmaceutical in 1989 by the Stephen Delphys. So nutraceutical can be defined as a food or part of food or a nutrient that provides the health benefits, including the prevention and treatment of the disease. So we always try to find out exactly about the myths about the Ayurvedic, and एक बात बहुत चलती है, मुझे सब पता है. So I know each and every term of the nutrition. When I'm just asking a person, have you got your enough calcium in the body? Oh, yes, I drink milk in the morning and I have plenty of calcium in my body, and still they are having some problems with the bones. I don't know what exactly mean by that. But we are having the different malnutrition practices in India, and the government is trying to cope up with some different solutions which can address the malnutrition issue. So basically, when we are comparing the nutraceuticals with the pharmaceuticals in some parameters as of the prevention and wellness, so nutraceuticals are the preventive medicines typically, or wellness medicines, what we can say. But pharmaceuticals are not preventive or wellness. They are trying to have a first line of treatment when they are emergency or something else. Medical supervision in case of nutraceuticals, it is not required. In case of pharmaceutical, is required. Overdoses, side effects are always having the key points for two. FDA approval, not required in the different dimension. And in case of pharmaceutical, it is required to go through the FDA approval. Prescription, definitely, nutraceuticals are not required any type of prescription. They are OTC products over to the counter. You need not to go to the prescription. In case of pharmaceutical, it is required. Results slow but effective, and in case of pharmaceuticals, yes, it is fast and may have the side effects. So there are some major health issues where the nutraceuticals are used by the medical practitioners even. So most of the MDs, or say the specialists, they are trying to prescribe the nutraceuticals as a part of their prescriptions. So in case of cardiovascular diseases, omega-3 fatty acids, polyphenols, vitamins, minerals are always prescribed. Say about the dietary fibers also. In case of diabetes, most of the prescriptions related with the diabetes or type 2 diabetes, when we are trying to find it out, so nutraceuticals are gaining their position in the prescription. In case of obesity, each and everyone knows about and if you are going through the YouTube or say the WhatsApp or say the different social media sites, obesity and uske liye bahut sare treatments are available on the social media. In case of cancer, yes, most about the curcumin, which is coming from the turmeric rhizomes, and US FDA has approved the curcumin as an anti-cancer molecule for their line of action. Anti-inflammatory activities of curcumin, which already you all know. So it is the classification of nutraceuticals which is given by the FSSAI, that is a Food Safety Standard Authority of India. So when we are trying to classify the nutraceuticals, there are two types. The one is the dietary supplements and one is the functional food. Right? So when we are trying to find out about the dietary supplements, the word itself suggests about the supplements. It is not the replacement. It is a supplemental thing. It contains vitamins and minerals, herbals, which again having the Ayurvedic extracts, algae extracts, plant extracts, protein supplements, definitely protein powder, and probiotics and others, even though the prebiotics are also there. When we are talking about the functional foods, probiotic fortified, omega-3 fortified, the oil, what we are, edible oil we are talking about, the functional beverages, energy drinks, sports drinks, fortified juices. So what exactly driven me to coming to the picture about the nutraceuticals, a paradigm shift? It has to be from the academic research also. Actually, the traditional path for research, it is by the researchers in the institutional labs only for the publication in the high impact factor journal. अपने यहाँ पे ऐसा ही होता है कि when we are having the academic research, it is only and only for the researcher करता है lab में, and typically with the antifungal, antimicrobial, and ऐसे प्रोडक्ट होते हैं either with कि जैसे नैनो टेक्नोलॉजी वाले प्रोडक्ट्स होते हैं कि जिनका मार्केट में शेयर बहुत कम होता है, और बहुत सारी कंपनियां ऐसे होती है कि जो इसमें काम नहीं करती नैनो टेक्नोलॉजिकल प्रोडक्ट्स में. But there are some companies which are trying to work on such products, but the typically market share अगर हम देखना चाहते हैं तो उसमें बहुत कम nanotechnological products market में आते हैं due to the cost factor. What it has to be a smart, required the path for research has to be. It is by the researcher in the institutional labs and must be in the collaboration with the industry. हम हमेशा एक बार सुनते आए हैं कि there is a gap between the academic as well as academic research and the industrial research. Why it has to be? इंडस्ट्री कैसी होती है और इंडस्ट्री और एकेडमिक्स में हमेशा एक गैप बनी रहती है. हम हमेशा यही सोचते हैं और हम मतलब ये सुनते आए हैं कि जो इंस्टीट्यूट्स में होता है, जो एकेडमिक्स में होता है वो, और जो इंडस्ट्री में होता है उसमें कोई रिलेशन नहीं है. वहां पे दुनिया बहुत ही अलग है. So I have seen, or I am working on the both areas. I am working in the academic area, I am working in the industrial area, and I am trying to see the gap. I am not feeling any gap. सिर्फ यही हो रहा है कि हम लोग एकेडमिक को प्रॉपरली अलाइन नहीं कर पा रहे इंडस्ट्री के साथ. Actually, our institutes or our syllabus, what we are trying to implement for our the graduation or the post-graduation studies, it is far beyond or far advanced when we are comparing with the industry, what is exactly required. लेकिन सिर्फ उसका एप्लीकेशन कैसे होता है and how we have to inculcate a professional attitude while learning any type of syllabus. And definitely the last point for that required path for research, it has to be for the society. अगर मैं बहुत अच्छा प्रोडक्ट बना रहा हूँ, तो अच्छा प्रोजेक्ट मेरा बन रहा है, अगर वो सोसाइटी तक नहीं जा रहा है, if it is not of use, any kind of use for a human purpose, so it is all vain. So some days before, when we around say 2018, and we were at the CSR Innovation Award ceremony, and what we have seen, a person who has developed a ring. So it is a ring, what we can say, we always try to have. So that the ring is capable of measuring hemoglobin. That is the most non-invasive technique to correct or to check the hemoglobin. So just you have to put that ring in your finger, and try to measure the hemoglobin within some seconds. So something like that, what we have to go with some projects, if we are having, it is for the society purpose. So what is exactly the paradigm shift? So when we are talking about the history and the history, mainly about the nutraceutical field, we Indians typically having a wide regime of nutritional aspects. When we are going from say north to the south region, and we were having the nutritional aspects checked or controlled by the mother in our home. So our kitchen is full of the nutritional things, but we definitely ignore such points, and we always try to follow the Western style of nutrition, which is actually based on the geographical region. In say US or in European countries, the temperature is always and always so well below, so 15 degrees Celsius or say the 10 degrees Celsius, and sometimes it may be in the minus 10 degree, 20 degree, it may be. So according to that, their genetics, according to the geographical region or say the physiological conditions, what they are having right now. So it is according to that therapy. But when we are dealing with the Indians, we definitely have, we were having actually the nutritional aspects when we are having our the full plate covering the from the chutney to the rice or say some subsies, some green vegetables right now. So we were having, but what we have to. And right now, each and every physicians and each and every the dietitian is trying to prescribe such and such type of nutraceuticals to supplement or this complement their diet. Definitely, prescription has changed. If you are going for a common cold or for say some simple symptoms of flu, and if you are going through what you have got prescribed by the physician, or if you will come to surprise that first thing it contains antihistaminic, the antipyretic drug, one antacid, typically anti-acidity drug, and two to three multivitamin. Definitely one out of that will be vitamin B12, a common thing which is rightly prescribed by the physicians. So this is the prescription change what we have seen recently. Definitely there is a need for the new molecules when we are dealing with say the new molecules, how to see the change is. So there is a limited scope for when we are trying to find out the new molecules. So if we are trying to synthesize the new molecules and we are trying to check its the pharmacological actions and its the applicability and or it's the SAR studies and all the stuff what we are go through, we have to go through the phase 1 study, phase 2 study, phase 3, phase 4, and up to that we have to spend almost a lifespan of around 5 to 10 years. And what we are needing right now, we are urgently in the need of. So have you seen the Gilda is getting sold over the market, and which is like in the tremendous activities are gone in last 10 months. That Gilda is the blockbuster molecule. So how it is that? So there is always a need for the new molecules, and it is only it will only satisfied by the introduction of some nutraceuticals. Change in normal health parameters, yes. So around in the 2000, the optimal diabetic optimal glucose range was 160. Before that, it was around 220, and eventually it is getting changed 120. Right now, it is what we are prescribed. We are having right now the optimal range for the glucose in the blood is about 140 deciliters per ml of blood. So it had changed. So normal height was normal height in the glucose range was observed, and it is by the different authorities or say from the ICMR, it is given that you have to so within one night, within 1 year, we have got the number of diabetic patients increase. That is only due to the normal health parameters. Previously 160, 140 or 140 and 100 was the normal blood pressure when we are trying to go through the physician. But nowadays it is 120, 80. So this is the parametric change what we are observing right now. So that is the need when we are prescribing the nutraceuticals for try to comply with the health parameters. Obviously, research projects, and when we are dealing with some research projects and when we are looking out at the research projects, when we are seeing it. So now you have seen, so a number of herbal molecules or say the isolated molecules are increasing for the research project, and we are having the if you are seen in the market, the number of pharmaceutical companies are diversifying their area from the synthetic molecules to the herbal molecules or say the biomolecules. So this is the change what we are seeing right now when we are dealing with the nutraceuticals, and most of the companies, so the leaders, so the big companies are trying to invest or so diversifying their projects from the synthetic molecules to the nutraceutical molecules. It is the same scenario when we are discussing about the worldwide status of nutraceuticals is gaining attention, and when we are seeing the worldwide way, so again in the US, again in the European countries, so nutraceuticals are gaining their attention in the pharma field also. So when we are looking after for the challenges, so first the challenge is about the pharmacokinetics when we are trying to develop a nutraceutical. In the nutraceutical cases, what exactly the pharmacokinetics when we are trying to describe it. So kinetics, the ADME, what we have to define in case of a nutraceutical is the biggest challenge what we are trying to, because nutraceuticals are not of dose requirements. So some of the curcumin dose of 100 milligrams, some of the products you may find the dose of 500 milligram of curcumin, and in such cases it's very hard to establish the pharmacokinetic parameters when you are formulating a nutraceutical. Same is the case with the pharmacodynamics. It is very, very strange when we are trying to define the pharmacodynamic parameters of the nutraceuticals, because in India, so it is always use of fenugreek seeds to control the glucose levels in case of diabetes. लेकिन अपने यहाँ पे ऐसा होता है कि अगर डायबिटीज मुझे जल्द से जल्द कंट्रोल करना है या क्योर करना है, I will have more and more amount of the fenugreek seeds, and the resultant may be in case of the gallstones, maybe the bile stones may be there due to the pharmacodynamics parameters are not well established, how it will be, how it is going to be, because most of the herbal molecules have the different pathways to cure or to elicit its pharmacological actions. So that is the case what we have to define. The genetic variability, yes, it has to be. And when we are discussing about the genetic variability all over the world, I'm not talking about all over the world, the genetic variability is there, that has to be there. But in case of India, what we are having from the north to south, so there is a genetic variability from the gender to gender, as well as from the regional. The genetic variability is there. Some are the fast, so the case of the allergic status may be there. Then about the cost structure. Most of the time it is observed that the nutraceuticals are having the highest cost when you are comparing with the medicine, and most of the customers or the clients, they try to refuse or to reduce the use of the nutraceuticals as it is of the costly. If you are trying to see about the omega-3 fatty acids, the cost of a single capsule, it may cost around the 15 rupees per capsule, and the total budget of that person. So he will try to have a medicine preferred over the nutraceuticals because the cost of the thing is. Then the national policies, it is the challenges, because it is one of the challenge that we are trying to face right now, because FSSAI, where we have to head to get approved our product and how we can market it out, because that is the biggest challenge, because our products are mostly having a thin line, because on the other hand, it may comes under to the medicine, that is the synthetic molecule. It may come around the Ayurvedic. It may come around the FSSAI, that is the food material. If you are trying to say, I'm selling the fish oil, where I have to head it out to get approved for my product. If I'm going to the FDA for getting approval of my product, it is again a constraint that the national policies are not there to define what exactly the product is. How I have to get the license for manufacturing of the nutraceuticals. Then regulatory understanding. So अगर हम मतलब न्यूट्रास्यूटिकल प्रोडक्ट का अप्रूवल के लिए लेके जाते हैं एंड वी आर हैविंग FSSAI, वो बोलते हैं कि सर इतना डोज नहीं चलेगा, आपको चेंज करना पड़ेगा. सो हम चेंज कर लेते हैं. अब वो बोलते हैं कि नहीं, आप FDA के तरफ जाओ, देयर यू विल गेट योर. So there is a regulatory understanding. We are not having the defined definition, proper definition of the product, where it has to be categorized under the nutraceutical, whether it has under the Ayush, that is Ayurveda, Unani, Siddha, and homeopathy. So we are. The next point is about the dosage forms. We are having challenges in terms of the dosage forms, as right now we are typically adopting the same pharmaceutical dosage form style to, or say the formats for the nutraceuticals also. When we are trying to address the dosage form issue, the biggest challenge is about the extracts, what we are trying to see in when we are seeing the challenges. Because if I'm trying to have a dose of curcumin, or say the turmeric as a nutraceutical, I have to consume around 2 to 3 grams of turmeric. Then and then only I will have, say, around 200 or 300 milligrams of curcumin in that. So in such case, I have to go for some extractions or isolation of that molecule, and I have to fit that isolated molecule in the typical dosage form. That is the biggest challenge what we are trying to face right now. The last issue is about the IPR, the intellectual property rights issue. When we are dealing with, so you all heard about the IPR issue of the turmeric case. So turmeric is one of the food ingredient what we are using since say about the 3000 years for n number of ailments. So हमें पता होता है कि अगर किसी को मतलब गले में खराश है या something like that, और हमें कुछ मतलब बुखार है, so definitely what we are using, we are taking a glass of milk and putting a tablespoon of turmeric and mixing it and just drink it. We will have the issue sorted out. And if we were having the patent which was granted by the US Patent Office, then and then only we may not have the turmeric what we can rightly using it up. अगर हम वो पेटेंट ग्रांट हो जाता था शायद, तो हमें ये करना नहीं पड़ता था. दूसरी बात ऐसी भी है कि what we can protect, हमारे यहाँ पे nutraceutical or say the nutrition or say the different type of the nutritional delivering components है, हमारे आजू बाजू में और से किचन में ही बहुत सारे मिल जाता है. So it is related with the food related things. और ऐसे केस में पेटेंट या जियोग्राफिकल इंडिकेशंस के बारे में हम हमेशा बात करते हैं, और वहां पे ही हमें ज्यादा इश्यूज होते हैं to, or in order to get into dosage forms or say in the nutraceutical product. So regulations in nutraceutical, when we are talking about the FSSAI, that is a Food Safety Standards Authority of India, has notified the food safety and standard, that is of the health, supplement and nutraceutical, the food for special dietary use, food for special medical purpose, functional food and novel food. So which was drafted and officially published in the official gazette on 23rd December 2016. And these were coming down into force after 1st January of 2018. So we were upgrading our regulations in terms of the nutraceuticals since 2018, and implementation definitely about the regulations of for nutraceutical manufacturing, selling, and import and exports as well. So exactly the current market of nutraceuticals, when we are talking to find it out, it is whatever the figures what we have trying to have about the 2019. So if you are talking about the global nutraceutical market, so between 1999 and 2002, industry grew at a 7% annum. And next few years, it will up to 2010. It is a double growth. So 14% per annum. And currently around 12 to 15 billion is being added every year. When we are saying about the Indian nutraceutical market is expected to be from the 4 billion in 2015 to 10 billion in 2022. But I will definitely say, so we may cross 30 billion in 2022 because of the pandemic and the role of say Ayurvedic or say Ayush products in the treatment of the COVID-19 and Atmanirbhar Bharat, and after that the thing. So we are, and it is again accepted by the entire world that the Ayush or say the some of the nutraceuticals are proven role in the curing of or say the prevention of the COVID-19 infection. So this is the exactly the growth what we are trying to have, and that's what we are trying to focus on, the nutraceutical market. So when we are seeing the global nutraceutical market, the core factors promoting the growth of this industry is including the increasing the health consciousness. Each and every the person who is living in the developed country or say the developing country is rightly getting a health conscious. Again, aging population, rising in the personal disposable income. So they are having a typical budget for, previously it was for the Complan, it was for the Horlicks. Now they are giving us some of the budget, typical the monthly budget for their protein, their fruits, and the rest of the stuff about the omega-3, and they are trying to focus it on. Increasing the penetration of the large retail setups such as hypermarkets and the supermarkets. So if you are going through some supermarkets or some the malls, definitely you will find some of the shelves filled with the Chyawanprash, some filled with the typical honey, and typical the nutraceuticals when we are talking about the fish oils, the flaxseed oil, role of the omega-3, and different combinations for the nutraceuticals. Marketing and promotional activities by the companies. So if you have heard about the Amway, if you have heard about the Herbalife, you have heard about the Organic India. So all they are promoting the nutraceuticals across the world. So industry is trying to look out in some trends that the rising demand of herbal nutraceuticals in Asian regions, rising penetration of foreign companies in the Asian region also. As the door is getting open, it is from the both sides. If we are entering into the world, if we are trying to satisfy the need in the world, definitely the foreign countries are foreign companies are trying to get their share in Indian region also, Asian region also. Energy boosting products are gaining grip in the US, typically of the caffeinated products, or say the caffeine pills, caffeine drinks are getting grip in the US also. The interest shifting to nutraceutical against the prescription medicine in the developed economies, because they are trying to look out what is exactly the side effects, what they are gaining from the metformin, from the typically diabetic drugs. And US FDA also pointed out the use of the nutraceutical as a co-prescription in the US market. Again, when we are seeing the Indian nutraceutical, India is a major economic among the developing countries. So per capita GDP grew at 11%, but we have seen up to the 2015. The changing lifestyle, increasing sedentary jobs propel the incidence of lifestyle diseases. So we all are aware about the sedentary lifestyle and the lifestyle diseases coming out of that, the sedentary jobs. The rising health awareness among the consumers, providing the platform for nutraceuticals to grow. What exactly the drivers for the industry? So aging populations. So elderly population to reach 143 million by 2020 from current 100 million. So a majority of the population of the age group, of elderly age group, is now entering into a big proportion of population. Increasing the co-prescriptions, and we have already discussed about the, in 16% of the prescription, a multivitamin product is prescribed. So now we are having the focus on preventive healthcare. Consumers have started realizing the importance of nutraceuticals in dealing with the health issues. So we already have the bitter taste of the Gilda, bitter taste of the ashwagandha, and bitter taste of the aloe vera, and all the stuffs during this COVID-19 pandemic attack. So rapid retail growth, India's retail market to double to US, so US dollars of 1.3 trillion by the 2020 from US dollars 600 billion, which was in the 2015. So which is, we can see the potential of the nutraceutical market. And if we are if you have to shift our focus from the traditional pharmaceutical, and if you can focus on the nutraceutical market, it will be a great opportunity to search for. Again, the dietary supplements are predominantly prescription based. The physicians, nutritionists, health instructors are the major influencers for driving these nutraceutical products. With growing awareness, OTC demand is increasing, and higher purchasing power also promoting the growth. Middle class is the major consumer, so we are having major focus on the health issues. Vitamins and minerals continue to dominate, definitely. So proteins, omega-3, probiotics, and herbal supplements to show the strong growth. Export opportunities for the health supplements. US is one of the major exporting destination where I have an interesting fact that one of my friend in US was in the supermarket, and he was observing neem stems. And the neem stems, 4 or 5 neem stems, short neem stems were selling at the cost of $10. And he just called me and they say, yes, what he got, that is a $10 he is giving, and he is getting around 4 to 5 small neem stems. And what we have seen, this is a major potential if you have seen in the nutraceutical world. So functional food and beverages are majority alike in appearance to conventional food and beverages. If you are heading to the market and you are trying to look out for oil, edible oil, so you will definitely try to see that is it fortified with the omega-3, it is fortified with the that is the HDL, that is high density lipoproteins, it is there or not. So these are consumed as a part of regular diet. So we are trying to focus it out. So it is fortified with the essential nutrients. So A, D, E, K. The government has prescribed a program which addresses such a fortification issues with the nutrients. Rising expenditure on quality food products driving the market. If you are heading for some fruits in the market, and if you try to find it out, you will ask that it is an organic one or not. If you are having some rice, you will ask for the brown rice. If you are asking for the bread, you will ask for the brown bread, because of the gluten and all the stuffs, all the issues what we are trying to face up. The functional food and beverage will grow strongly. Definitely, this is the promising area where we will try to work out. And being a pharmaceutical, from the pharmaceutical background, from the nutraceutical background, so we can address such issues. Because from the industry, the food industry point of view, or say if the food technology technologist, if you are trying to work with the food technologist, they are not on this such side. They know what exactly required, but they are not on the part of how to fulfill it. So what exactly the nutraceutical marketing model will we look out if we say the manufacturing unit? So if you are having the direct sale through the small companies, or you can put from the e-commerce background, e-commerce platform, and that will end up to end consumers. It will through the Amazon, it will through the Flipkart, through the health card, and any number of the e-commerce website what we are having. Or otherwise, it is from the certified food operators. It is with the stockists, dealers, and it, through the hospitals or the retailers, it will reach to the end consumer. So this is exactly what we are trying to see, the scenario. So definitely the whole focus, we know about the nutrition, we know what exactly the molecules which may act as a potential candidate for the nutraceuticals. What exactly the key area where we have to look out, that is about the regulatory aspects and the formulation aspects. Because when we are looking out, where we can compete with the market leaders, vitamin C market may have, how we can give a better. So 500 milligram hai, I will put 1000 milligram of vitamin C. ऐसा नहीं होता है when we are trying to work in the regulatory aspects. It has to be a formulations, how we can. So that is the formulation aspects or formulation dimensions what we can give. One thing, so I will have a better formulation, better in terms of the consumer acceptability. It will have a better pharmacokinetics, better pharmacodynamics, better packaging. The patient acceptability or the consumer acceptability has to be addressed. So what exactly the FSSAI, that is a Food Safety Standard Authority of India. So product approval has to be found in the provisions contained in the section 19 to section 22. And what exactly the section 22, it gives different categories of the nutraceuticals, the food, categories of foods. So first one is the genetically modified articles of food. Second is about the eradicated foods, organic foods, foods for the special dietary use, functional foods. This is the category what we are trying to look out, that is the nutraceuticals. Then the health supplements, proprietary food, and novel food. Though they have given the different categories of foods, but what exactly the organic food it will be. And when you are seeing the separating lines, separating the criteria, what I have to call it as organic food, what I have to call it the functional food, what I have called to be the nutraceuticals foods, they are overlapping to each other. That is the biggest dilemma when we are trying to file our product approval process. So this is the main thing. But according to the FSSAI, if you are filing your product with the FSSAI, minimum say around 5 to 6 years, you have to wait in order to get it clear from the FSSAI because of the guidelines. The food products where the safety of its ingredient present are known and not contain plant, botanicals, or substances from the animal origin will be granted for approval. It has to be clear cut what exactly the FSSAI has given. Exactly the list of ingredients is given. You have to select between those products only. So documents required. So complete list of ingredients, specify the level of its use. You have to give exactly at what concentration you are trying to use it. The copy of the label for the products in the market or to be placed in the market. We have to submit the label. The category number of the product as applicable under the Indian Food Category Code. So it is given in the food category code. It is given in the book, and you have to give something like if You all know about the sweeteners and the sweeteners, or say the colors, what you have used in case of pharmaceuticals, something like that. The Indian food category code is there, and you have to select the number which is suitable or applicable for your product. The food products where the safety of its ingredients present are known and contains plants, botanicals, and substance from animal origin will be granted for approval. Also, they have given the two sections, one which is not having the plants, botanical, and the substances from the animal origin, and another one from the plants, botanicals, and substances from the animal origin. So you have to give the safety of the product, and only on the basis of the risk assessment, the data you have furnished, the FSSAI, the authority, will assign you the licenses or say the product approval. So a product for which the safety of its ingredients and their conditions of use are stated therein and published by the FSSAI with the documents, you have to give the complete list of ingredients, copy of the label, category number, and the copy of the NOC or the product approval issued by the FSSAI. You have to give safety data wherever required for all ingredients, the use of minerals, vitamins, the proteins, metal, amino acids, and their compounds should not exceed the recommended daily allowance for the Indians. You have to pay to the fee of say around 25,000 INR. So regulatory requirement for entry in India, some of the products we always try to get imported from the foreign countries. So it has to be deal with the product evaluation, product analysis, licenses, and health and label claims. So no person shall import any unsafe or misbranded or substandard food. Foreign Trade Act is there, so which gives the clear-cut definition of what type of products we can import from foreign countries. All imports will come under the central licensing. So we will consider the central licensing, what it exactly is about. When we are getting approval for the approval process for the site registration or the manufacturing license, so you have to apply to the state licensing authority for site registration in the Form A. After approval of the site, there will be inspection, and after that inspection, you will get the approval of the site. If the rejection is there for the application, you have to again file with the modifications or whatever the changes suggested by the authority to the licensing authority, and then again it will come down to the inspection and the approval of site. Then apply for manufacturing license in the Form B. We will see what exactly the Form B consists of and what exactly the Form A consists of. Then you have to find, you will get a unique application number will be get issued. And after that, if there are some queries or some responses based on the inspections on premises, after fulfilling those queries, you will get the grant of license and manufacturer shall start the business. Okay, so when you are coming down to the sale of nutraceuticals in India, do I need a license to sell a nutraceutical? Typically, yes, but not as stringent as that of the pharmaceuticals, or say when we are dealing with some medicines. It is by the FSSAI. The three types of licenses are issued. So one is the central license, another is the state license, and third one is about the basic registration, or we say the basic license. So what exactly the central license it is? It is for the major manufacturers or the food business operators. So we are having the turnover more than 20 crore rupees. So they can apply for the central licenses, the large food business operators. For turnover about 20 crore, in case of manufacturing or trading or storage beyond certain limited as specified by the law. You have to go through the central licenses. When you are coming down to the state licenses, it is for the medium food business, turnover from 12 lakh to 20 crore rupees business. So this is for the food business, for the food license, business with turnover between 12 lakh to 20 crore annually or additionally. The turnover limit is same for the FSSAI state trading license or FSSAI state manufacturing license, which is between the 12 lakh to 20 crore rupees. The basic registration, it is for the petty food business, the small business who are having the business up to the 12 lakh per annum. So when you are dealing with what exactly the documents required for the FSSAI registration, so photo identity of the food business owner, NOC by the municipality, panchayat or health NOC from the medical practitioner. Registered medical practitioner will issue you a certificate about the person, that the person is not having any type of health issues. PAN card, proof of possession of the business premises, and a declaration about the business details in the form A. Okay, what exactly the documents required for the state and the central license? Form B, which is duly completed and signed, blueprint or the layout of the processing unit. Then Form 9, which consists about the exactly about the nomination of the business, what is the type of the activities which will be carried out inside the premises. NOCs from the municipality or local body, source of milk and meat if it is applicable, food safety management system plan and recall plan, obviously if it is applicable, and proof of possession of premises. So moreover, the documents are similar. Additional documents may require for the central license if you are carrying out some manufacturing activities. Certificate from Ministry of Commerce and Industry, Department of Commerce for 100% export-oriented units. Supporting document to show the proof of annual turnovers. The NOC document issued by the FSSAI department, import-export license or code certificate issued by the Department of Goods, the foreign trade. Okay, so when you are seeing the fee structure for the central license, it is about the 7,500 rupees for a new license. And if you are getting renewed by year, so it is around 7,100. In case of state license, it is in between 2,000 to 5,000, depending upon the state wise. In Maharashtra, it is 2,000 rupees per year. And in case of the basic registration, which you have to get in case of any type of food business operations. First year, it is about the 100 rupees per year, and subsequent you have to pay 100 rupees per year. So how do nutraceuticals enter into the market, and what are the different aspects? The nutraceutical market entry points gives with the product evaluations, the product analysis, developing India-specific health and label claims. This is more and more required because in India, what we are trying to develop the nutraceuticals considering the 2,000 kilocalorie pattern. And if you are looking at the foreign countries, say about the European countries, you have to consider about the 3,500 kilocalories. That is a major difference when you are considering the health or say the label claims what we are trying to. Then the processing licenses, import licensings. Most of the times when we are looking for the protein or say the whey protein or say the pea protein, brown rice protein, say we are typically about the casein or say albumin, most of the time we have to get it imported, or some of the ingredients, some of the excipients, what we have to procure from. Say about if you are trying to come up with a collagen supplement, so we have to get it from the bovine collagen as an ingredient. It is from the Germany. And in such case, we have to get import licenses for obtaining such a product. Then again, the manufacturing licenses and marketing licenses. So all these issues, what we have to address when we are considering about the nutraceutical business. FSSAI in India has starting from its regulations in the 2016 that standardized the manufacturing of the nutraceuticals. And food business operator may manufacture nutraceuticals from the food or non-food sources. So when we are saying the vitamins or say from minerals. So nutraceuticals manufacture should contain ingredients specified in the schedules only. They can't go beyond those schedules. So what exactly the FSSAI has given the schedules? The schedule first contains a list of vitamins and minerals. So you have to follow that schedule only. You can't go beyond those schedules. Schedule 2 contains a list of essential amino acids and other nutrients. Schedule 4 gives a list of plant or botanical ingredients. Schedule 6 gives a list of ingredients as a nutraceutical. So this is more or the keen interest what we are trying to deliver. The schedule 7 gives a list of strains as probiotics. That is about the live microorganisms what we are delivering in case of capsules or say the probiotic drinks maybe. Schedule 8 gives a list of prebiotic compounds what can be used as a prebiotic compounds for some probiotic formulations. So quantity of nutrients in the nutraceuticals must be as per the RDA. When daily minimum and maximum users levels are not specified, relevant data and evidence should be considered and submitted by the food business operator. What we have to, if it is not prescribed by the ICMR or by the National Institute of Nutrition, we have to prescribe or we have to specify the relevant data or the evidence that will consider as a minimum and maximum levels what we can use for that typical nutraceuticals. Additives, they must be specified under the schedule 5A, 5E, and 5F. So already approved nutraceuticals are there, something like the curcumin, which is already approved. There is no need to go for submission of or say the specifications related with the uses. So what is exactly the recommended dietary allowance when we are trying to find out? Recommended dietary allowance are the levels of intake of essential nutrients that on the basis of scientific knowledge and are judged by the Food and Nutrition Board to be adequate to meet the known nutrient needs of practically all healthy persons. RDA doesn't apply to the sick people. It is given only and only for the healthy people. It is for the prevention. It is for the wellness. It is not for the curing of such in a disease. It is for the prevention of the disease. So in that case, it is given by the RDA. It is a typically a diagram given for the sake of example when we are considering how the RDA are considered. It is given by the ICMR, and when you are seeing the group as a man or say as a woman, and what exactly it is based on the sedentary lifestyle, moderate lifestyle, heavy working style may be there. And in case of women, there are different categories from the sedentary to the work style, the pregnancy maybe, situations maybe there, lactations, or different tenures of the lifestyle. Again, in case of the body weight, it is considered as a on an average, so what exactly the Indians may have. And after that, the net energy calculations in terms of, say, if a man is having the 60 kg, it may have so 2,425 kilocalorie as a per day. And how it will be divided in different, say, the proteins, it may be having 60 grams. So it is taking a ratio of 1:1. So 1 kg, 1 gram of protein must be there. And in terms of that, so what exactly the fat requirements, calcium requirements, and the iron requirements may be. So it gets changed from ICMR to the name from the US FDA. So each and every nutritional board prescribes their values, the normal ranges from the different styles. So when we are considering always the nutraceuticals, and nutraceuticals are always coming up from the plant origin, and in India, nutraceuticals are often considered as a herbal medicine. They are not having their special status. If you are trying to look out for a nutraceutical, you will definitely come to know that you will observe it, that one of the ingredient is of the herbal origin. So what exactly, or what we are implementing right now, we are not following exactly the FSSAI, because FSSAI are working or getting implemented in India only. But the same product, if we are trying to market in the US or say the European country, we have to cope up the guidelines of their origins. So WHO is the only thing which is getting applied or is getting accepted all over the world when we are seeing the nutraceuticals, and when we are following the WHO guidelines, we follow the guidelines for the herbal medicine. So what is exactly the traditional medicines and what we are trying to find out as a nutraceuticals? So WHO defines traditional medicine as including diverse health practices, approaches, knowledge, and beliefs incorporating the plant, animal, mineral-based medicines. Because most of the time what we have seen, instead of waiting for the approval from the FSSAI, from the different authorities, so we may follow the traditional medicine guideline, and we will follow or we get approved from the WHO. And it is the best practices because we are following the GMP, that is the good manufacturing practices. And we are having a over age, or say the cutting edge over the other competitors, that we are having the WHO approved plant for manufacturing nutraceuticals, and others may have the FSSAI approved manufacturing premises. So we are having overage from those competitors. And how the traditional medicines is considered. So it is about the inclusive system, tolerance system, and integrated system. So we are inclusive system. We in India follow the inclusive system of traditional medicine, where we are addressing, we are respecting the Ayurveda, Unani, Siddha, homeopathy. We are trying to incorporate, we are trying to include such system. But most of the times we are, being a developing country, we try to focus on the, say, the allopathic medicine as our primary treatment. So there are different challenges when we are coping from the nutraceuticals to WHO guidelines for the herbal medicines. And these are some challenges when we are seeing. First of all, the safety, efficacy, and about the quality. So lack of research methodology. So it is a classic example what we are seeing in case of rural area, and what we are seeing that if the person is having a bone fracture, so it is given that it is prescribed by the elderly person there. So first thing is about the haliu. I don't know exactly the name or the botanical name or say the scientific name of the haliu. The second is the harjot, that is Cissus quadrangulus, or say the shallaki may be there, right? That is a Boswellia, Sirata, and all these things stuffs. So we are not having exactly the research methodology to define the safety, what may be the dose, what may be exactly the side effect may be, what may be the pharmacokinetics, what may be the pharmacodynamics of such thing. We have to establish what we are lacking of the research methodology to address or to incorporate such a material, such a nutraceutical, such a potent natural material into the traditional medicine, or say the nutraceutical. Inadequate evidence base. We are not having exactly the evidences, or say evidence-based research is not there for our traditional medicine, or when we are saying about the formulation development. Lack of international and national standards for ensuring the safety. We are not having much stringent norms which may address the safety, efficacy, and quality control test for the traditional medicine. The lack of adequate regulation and registration of herbal medicines. We are inclusive, but when we are seeing the rest of the world, they are not having any regulation to incorporate the herbal medicine as a part of their region. Lack of registration of the traditional medicines providers, because US FDA right now in the say 2019 trying to incorporate the traditional medicine. Inadequate support from research. Obviously, we are aiming to get a high impact factor research article in a reputed journal, but we are not heading to have a support for research to develop the traditional medicine. So this is exactly what we are facing right now, and this is exactly the WHO global strategy directions. We are not knowing where to go, because some of the WHO say these are the guidelines you have to follow. In some states we have to follow the other guidelines, and this is exactly the situations we are in the dilemma or in the confusion state where to go. And that's what majority of the researchers or majority of the nutraceutical manufacturers or the traditional medicine manufacturers, they hesitate to go in the market to manufacture. So when we are looking at the guidelines, so these guidelines aim to propose to member states a framework for facilitating the regulation of herbal medicines. You get clear cut given the classification of herbal medicines. It is from the plant, it is from the animal, it is from the mineral origin. They also give the minimum requirements for assessment of safety of herbal medicine. So India, any person or say if you have seen the walls of any bus stand or say the railway station, you will find the number of advertisements are there about the treatment with the herbal medicines. If you have gone through the newspapers, you will observe so and so herbal medicines are there for so and so. But what about exactly the safety guidelines, the safety issues with those things? And again, the social media is covering the n number of, rather creating n number of health issues because of not proper guidelines or not prescribing the minimum requirements for assessment of safety of such things. Again, about the efficacy also, there is a lack of, they are trying to give the quality assurance of herbal medicinal products. This is the area what we are trying to look out, what exactly the quality assurance of herbal medicinal products. Because ऐसा होता है कि अगर pharmaceutical field में लेते हैं, they are having the consistent quality build up from the raw material to the finished product. But when in case of the herbal medicinal products, it being it's a natural status or natural behavior, and being it's a natural thing, the variation is the most common thing. And how you can ensure about the quality when it is from the natural origin. So we have to ensure or say about the quality assurance of herbal medicinal products. Then about the pharmacovigilance of the herbal medicinal products, it is prescribed, it is given in the guidelines by the WHO, but pharmacovigilance in case of herbal medicines, it is not at all getting implemented in India when we are seeing, or rather in the Asian region. Because Ayurvedic, Unani, Siddha, homeopathic, or say nutraceutical don't have any type of side effects. This is the assumptions each and every consumer or say the patient have in their mind. But it is not the case. Pharmacovigilance has to be there. The control of advertisements, we have already talked on the advertisement of herbal medicinal products. Then we are having the national policy on traditional medicine. right now. After 2018, we are having, but there is a lack of common standards and appropriate methods for evaluating. So we are having the Indian pharmacopoeia, we are having the Ayurvedic pharmacopoeia, but we are not having the nutritional or say the nutraceutical pharmacopoeia. This is what we are lacking behind. And when we are talking about the traditional medicine, there is no common textbook or say the reference books where you can use it as a standard or appropriate methods for evaluating the traditional medicine. So when you are going through the general guidelines for the methodologies on research and evaluation of traditional medicine, these are the guidelines given by the WHO. So it is based on some research and evaluation of herbal medicine. It gives research and evaluation of traditional procedures based therapies, because when you are looking down the nutraceutical manufacturing, say about the traditional medicine, so these are coming from the traditions or from the generation to generations. So there is a classic formulation in Ayurveda that is about the kajali. That is the preparation, that is amalgamation of mercury and lead. And if you are prescribing the kajali formulation in India, it is all safe. But when you are exporting it to the US or to the European countries, you will definitely have the issues for getting approval. Then it also gives the clinical research norms, because in case of pharmaceuticals, it is already well-established norms are there. But in case of the traditional medicine or say the nutraceuticals, right now it is getting prescribed clinical research. Then other issues and consideration of the ethics, education, training, and surveillance system, it is prescribed. But there is a big question or say the biggest challenge in implementation of such guidelines. So exactly this is a constraint for the commercialization of the herbal medicinal products. We are exporting to many countries, but achieving the regulatory compliance is one of the major hurdles, because we can't comply with the regulatory compliance standards when you are heading to the US, because they are having the sophisticated analytical techniques, the high-end analytical techniques to screen our products. And when they are trying to put our products under those lenses, so we are very much in trouble that how to get compliant with the regulatory guidelines. Then differences in the country-specific GMP standards and drug registration requirements are considered the major impediments for the Indian manufacturers. Because when we are having the TGA, that is the Therapeutic and Therapeutic Good Administrations, US FDA, European guidelines, EMEA, and about the WHO, we are having very much, we have to deal with the different countries to deal with some GMP standards. Different regulatory requirements and subsequent delays in application submission, that is the biggest challenge what we are going to face right now. In India, the traditional herbal medicines such as Ayurveda, Siddha, and Unani are considered safe because of their long history of use. As such, no safety and efficacy studies are required for marketing approval. It is given in the Drugs and Cosmetic Act 1940. But when you are the same formulation, if you are exporting to the another country where they are having their guidelines, so yes, you have to give the safety and efficacy studies. The State Food and Drug Administration regulates the manufacturing and marketing approvals. So if you are living in Maharashtra, so FDA, which is in your state, will address such a manufacturing and marketing approval issues. In US FDA, US state, US FDA, dietary supplements, and the Dietary Supplement Health and Education Act 1994 defines the whole operations of the manufacturing as well as the marketing. The manufacturers do not need to register their products with the US FDA or get approval before producing or selling dietary supplements. without any health claims, because doing so does not require any scientific evidence. So you don't have to give any health claims when you are heading to US FDA. So again, there is a limited market in foreign countries, as there is a scarcity of herbal practitioners. We in India, almost, if you are saying the 10 registered medical practitioners are there, out of that 10, minimum 5 to 7 practitioners are herbal practitioners, or say Ayurveda practitioners, Unani practitioners, or homeopathy practitioners maybe. And if you are dealing with overseas countries, there are very limited, there is a limited recognition of Indian herbal medicines. We can sort that issues. Again, this is with the issues with the standardization of raw materials. So when the quality of the herbal product is questioned, standardization of raw material emerges as a major issue for the Indian herbal industry. As per the Department of Ayush, nearly 600 medicinal plant products, 52 minerals, and 50 animal products are commonly used in the traditional Ayurvedic preparations. And medicinal plants are easily contaminated during the growth, collection, and processing. And more than 50% of the companies face problems in collecting and authenticating raw materials. So, and we are one of them. So we are considering such issues. Further, 36% of the companies consider adulteration of raw materials, because apne yahan pe to sab kuch chalta hai. So the major issue is with the quality attitude. The major issue is with the professional attitude, what we are implementing while manufacturing, while marketing of the nutraceuticals, or say the traditional medicines. Substitution, adulteration, and heavy metal contamination. So these are the most common things, because most of the agricultural land is contaminated with the water, which is already containing high levels of lead, arsenic, or most of the times they are just getting in their site near to the industrial premises. The intentional or accidental presence of toxic heavy metals is reported at all steps, beginning from the collection to the final manufacturing. Then several markers such as taxonomical, chemical, genomic markers, proteomic markers. So this has to be implemented, or rather it will help to identify the herbal drug components. Although developed countries require the chemical fingerprinting and marker-based assessments of raw materials and active ingredients for assuring its quality, in India, this concept was only recently introduced. The Indian GMP regulation does not provide any guidelines for marker-based identification. So again, the lack of regulatory guidelines, we are having the GSEP, there is a good agriculture and collection practices and good storage practices also. But implementation is the biggest challenge. We are having the guidelines for the preclinical safety evaluation, but we are failing here. We have tried to give the references from the textbooks, the ancient textbooks. We are trying to cover up because of the budget. The budget required for the preclinical safety studies, budget required for the clinical studies, budget required for the pharmacovigilance is much, much higher. And what exactly the revenue, or what exactly the break-even what we have planned will not meet within the tenure what we have assumed. That is the biggest issue what we are facing. Guideline mein diya hai, definitely we have to, but it is the biggest challenge when you are coming down to the numbers on the spreadsheet, and if you are going to spend a large amount, it is the biggest challenge. Then the classification of herbal medicines, they have classified, because most of the nutraceuticals are from the herbal medicines only. So indigenous herbal medicines in the systems given by the Ayurveda, Unani, Siddha, directly as it is. If you are saying about the fish oil, it is given as a matsya taila. You don't have to put any other fish oil omega-3. You will get your licensing. Why we are dealing with, why we were discussing about the traditional medicines? Because of the approval procedure. Approval procedure doesn't recognize what type of product you are using, what type of product you are trying to ask for approval. That's one. If the situation may be, if you are getting categorized under herbal medicine, you must know what exactly the guidelines may be. The third category is about the modified herbal medicine, which can say the proprietary medicine. And fourth category is about the imported products with the herbal medicine base. So quality control of herbal drugs, I will put the slide. The standardization of the quality evaluation of herbal drugs, what we have to give the data about the, this is the same is case of the nutraceuticals also, because of that is also considered as a herbal drug most of the time. You have to give the color, odor, taste, texture. You have to give through the HPLC fingerprinting, secondary metabolites, DNA fingerprinting, HPLC data, gas chromatographic data, HPLC data. You have to give through the microbial contamination, that is a major thing. Then you have to give the pharmacological data. Right? Okay. So regulation in India, herbal drugs are regulated under the Drugs and Cosmetic Act. Department of Ayush is the regulatory authority which governs the manufacturing to marketing to the post-surveillance activities. Again, DNC Act extends the control over the licensing, formulation, composition, manufacture, labeling, packaging, quality, and export. Again, Schedule T, which relates with the manufacturing of the herbal medicines. But in case of the regulations US, so already what we have seen, it is under the Dietary Supplement, Health and Education Act 1994. These do not require pre-market approval. You have to go with your product. You don't have to require the pre-market approval and directly start marketing. But only and only thing, the claims need to comply with the regulatory guidelines issued by the FDA. So which is very simple thing. But when you are meeting the claims need to prescribed by the regulatory guidelines, it is very much tough to meet those guidelines. The manufacturing of dietary supplements should be done as per the current GMP for dietary supplements, exactly in the US. It is again in the case of Australia, the Therapeutic Good Administration is governing authority, and that looks out the herbal medicine as well as the nutraceuticals. In case of European Union, when you are trying to market your product, you have to give the data. At least your presence has to be of 15 years. And then only you have to give the data of the safety, efficacy, or say the pharmacological actions of 15 years that has to be in the uses or in the treatment. I will skip the regulation in European Union. So this is the most important herb-drug interactions. As we have already discussed about, nutraceuticals are prescribed as a co-prescription. We have to go for the herb-drug interaction studies, or say the nutraceuticals and drug interaction studies. So medicinal herbs or pharmaceutical drugs are therapeutic at one dose and toxic at other. So there are n number of case studies given at the FSSAI that these combination has to be avoided when you are formulating. So interactions between the herbs and drugs may increase or decrease the pharmacological or toxicological effects. So this is the same case with the nutraceuticals also. So when you are trying to synergistic therapeutic activity, effects may complicate the dosing of long-term medications. So if you are putting metformin or glipizide or any anti-diabetic medicament along with say from the fenugreek, from the Karela, and from the all other the herbs, or say the nutraceuticals, in combination with the synthetic molecules, it may theoretically precipitate the hypoglycemia if taken in combination with the conventional drug. So this is the cases right now coming into the picture that we have to be more concentrate, or say, having more concern about the herb drug interactions or nutraceuticals drug interactions. Exactly what is the Schedule T? We have to follow this Schedule T because some of our products are considered under the Schedule T. That is the good manufacturing practices given in the Schedule T, and different raw materials used in the manufacturer, then manufacturing process, adequate quality control measures, and about the quality control test also. So what exactly the Schedule T, when we are trying to find out, to achieve the objective listed above, each licensee shall evolve the methodology and procedure for following the prescribed process for manufacture of drugs, which should be documented as a manual and kept for references and inspections when the audits are there. So this is the point where most of the nutraceuticals or say herbal drug manufacturers lag behind. However, so there are some exemptions. So about the Vaidya's or Siddhas or Hakims are exempted. So this is as per the Schedule T. They don't have to put all the documents ready for the inspection. So what exactly the herbal drug regulations, when you are talking about the Schedule Z, requirements and guidelines for the permission to manufacture the Ayurveda, Siddha, Unani drugs for sale or to undertake the clinical trials. So what exactly the shelf life? They have given the type of the dosage form, and according to that, the shelf life, what is exactly the prescribed. Definitely, which is already we have covered about the regulation in India when we are saying herbal drugs. It is under the Drugs and Cosmetic Act, and Department of Ayush is regulatory authority. Again, which covers. So Ayurvedic drug manufacturing license approval. So what exactly? You have to give the approval of plan of premises. You have to give the plan. That is a blueprint of the premises or the plan of premises. Submission of application with the documents to the licensing authority for the grant of licenses. Inspection of the premises by the inspector and reporting to the licensing authority for taking action. Then there is a grant of license by licensing authority. In case of rejections, you can appeal it also. Then renewal of license, additional product permission, if it is there. All these are given in the Drugs and Cosmetic Act, or what exactly the Ayurvedic drug manufacturing license approval process it is. So when you are talking about the approval of plant of premises, what is exactly the requirement? The manufacturing area, it as per the Schedule T. So when you are comparing with the pharmaceutical premises, it is each and every section is a separated one. So that is the uniqueness, or what we are keeping those area only for the manufacturing of the tablets, manufacturing of the steroids, manufacturing of the antibiotics. But in case of the Schedule T, when you are comparing with the pharmaceuticals, it is different. So what exactly? Office has to be minimum 100 square feet. Workers' rooms has to be there 80 square feet for each gender wise. Raw material store has to be minimum 100 square feet. So if you can go through what are the requirements of the premises, you will find that setting up a pharmaceutical, nutraceutical industry, or say the Ayurvedic industry, is quite easy when you are comparing with the pharmaceutical industry. And if you are having the different dosage form manufacturing under the premises, you need not have the specialty areas. So additional submission is required for the what exactly the typical application form has to be accompanied with. So I will go through some the important points. So it requires the list of machineries and equipments, label of the each product you have to give, list of the laboratory equipments, list of the approved technical persons with their degree and experience certificates, appointment letter and acceptance letters, and form 4 copies. So when you are trying to put pharmaceutical industry, approved staff has to be there, approved in terms of FDA approved stuff. But in case of nutraceutical manufacturing company, there is not at all requirement of the technical staff. What I am trying to say about the manufacturing, but it is come down to the quality control lab, testing lab. It has to be FDA approved chemist. It has to be. In case of the Ayurvedic manufacturing, Unani manufacturing, you have to take on your board at least Ayurvedacharya or Siddhas or Hakims on your board. But for the case of nutraceuticals, there is no need to have a technical person for the manufacturing. Right? Okay, anyone who is a trained or who is an expertise in such a manufacturing, you can adopt it. So detail of method of analysis you have to give. So list of SOPs, consent letter of public testing laboratory you have to give. There is another provision where you can adopt or say you can sign a MOU with the public testing laboratory or say the third party laboratory. If it is there, you can save your budget. Then master formula card for each product you have to keep. Again, same about the batch manufacturing record you have to keep. So again, these are a list of documents which we require. Always try to maintain when we are, there is a master formula records, then the product recall documentation, store documentations when we are having different types of audits. So again, Ayush also prescribes a guideline for the good clinical practices about the preclinical as well for the clinical studies. And also it gives emphasis on the clinical practices. So clinical evaluation, preclinical evaluation. So it is given in the Ayush guideline. So we have to submit the protocols, we have to get it approved, we have to go through the clinical trials, we have to come up with the statistics, and then we have to submit the data or say the files to the Ayush department to get approved for our product. So nutraceutical industry, the road ahead, FSI should come up with the properly framed guidelines. There must be some clear-cut guidelines when you are trying to say about the nutraceutical, when you are trying to say about the traditional medicine, herbal medicine, or any other product category. It has to be a clear-cut, properly framed guidelines. Private players and government should create awareness through the campaigns, social media, and television. So because what we are, so as per the story, what we have, the Sufi story, so we are all standing in different locations and we are trying to design, or we are trying to identify how the nutraceutical field may be, right? So this is the concern, what we are trying to. The product approvals should be fast and efficient, because normally last 6 to 7 years, we have filed around 7 applications in FSSAI, and still we are chasing that product approval very keenly, because we are trying to grab the market. Otherwise, some another company will come up with those products and will get. So it has to be there. To curb the malnutrition, children should be provided with the nutraceutical in midday meal. So definitely it is a responsibility of a nutraceutical industry to come up with some formulations which make up the malnutrition children. Strong control over the counterfeit on unregistered, unapproved products is required. So you have seen, or you have come up with some news in the social media or say the television that some person has got a supplement from a gym trainer or from some company, and she got a hypothyroidism, or he got some hyperthyroidism disorders, or some cerebral palsy may be there, but maybe a number of issues may be there. So such counterfeit or unregistered, unapproved products should be controlled by the FSSAI from the nutraceutical practices, nutraceutical industrial practices. Focus on improving the number of food safety testing laboratories, because we are lacking behind. So this is not exactly the current example, but few days before, so Maharashtra FDA got some inspections at the mithai shops, and what they have got with the khawa, let's say the mithai was contaminated or adulterated with a number of things. So there is the nutraceuticals FSSAI should focus on improving the number of food safety testing laboratories. The classic example that is again given from the FDA about the food safety. There is one hotel say, or say a Shopee, a mithai Shopee, which were selling the cholesterol. In Marathi, what we call is as the kharvas. And he was selling around 500 to 600 kg of that cholesterol or say kharvas in a day. And surprisingly, we always having a touch with FDA for some cases or for some issues, and they direct us the such case to identify what exactly the product is, how it is. So it is so tasty. So I have tasted that product, and we gone there, we inspect being some customers, and we found that yes, it is tasty. And we asked the retailer, can we have a sample of that? So for our relatives, and we got a kg of that kharvas packed by that retailer, and we come up with our lab, and we tried to find out, is it a really it's a cholesterol? Is it that the kharvas typically what we sought to have? Actually, you will surprise and you will really got to have a look in such cases. It was a gelatin, and gelatin mixed in the milk and having the whey protein, because most of the food testing laboratories, when they are coming up with the analysis of the cholesterol, they try to find out what is exactly the protein content, whether it is from the milk or not. That's it. Max to max, they will go for the immunoglobulins, which is present in that, but most of the food testing laboratories don't bother about that, because that is not the purview of their testing. So they try to find out the proteins are there or not. Yes, it is there. So they have given the testing certificate that it is safe to use. Now the question is it safe or not? It is safe, but it is a malpractice. So there is not a single, the cow herd which will give you 500 kg of the milk, the cholesterol milk, for a day. So there is not a single dairy which can produce 500 kg of cholesterol in a day. And that is surprisingly the issue what we are trying to. So I will like to focus on such issues. Then funding, incentives and subsidies should be provided to aid technology to uptake and improve the R&D. So yes, there is a need to come up with some funding, incentives and subsidies for the nutraceuticals. So what is exactly our vision is what we are trying to have the innovation. It has to be natural, 100% organic. I mean, it comes down to the organic. Organic is organic. It is 100% chemical free by the thought process also. Chalta hai approach? Nahi. What is what we have given? It has to be there. अंदर कुछ है, बाहर कुछ है, बाहर क्लेम अच्छा है, अंदर कुछ नहीं है. No. It has to be a natural, it has to be organic, and it has to be research driven. And definitely, we have to think about the sustainability, because we are living in an environment where the sustainability is come prior to the rest of the issues. And this is what we always try to do. It's a long journey of 1,000 miles begins with a single little step. And we are still working to make nutraceuticals working. So coming to the, thank you for patiently listening to me. And if there is any suggestions, I'm welcome. And thank you for giving me the opportunity to share my thoughts.
Thank you very much, Dr. Suhit. Thank you very much for explaining all the regulatory aspects to the extent. Shall we open this session for the questions from audience, Dr.
Yes,
Suhit?
ma'am, please. Yes, please, ma'am.
Okay. Now the session is open for questions. So delegates, participant delegates may unmute the microphone and ask the question directly, or they may type the question in the chat box. Dr. Suhit, may I
Yes.
ask you one question?
Yes, please, ma'am.
हाँ, बहुत सारे लोग ऐसे होते हैं कि कई आयुर्वेदिक रेमेडीज दे मैन्युफैक्चर एट होम इटसेल्फ, है ना, कोई पॉलीहर्बल कॉम्बिनेशन या मिक्सचर कुछ भी. So is it okay if or such manufacturer can he sell such product in Indian market without FSSAI approval?
To be very frank, ma'am, no. But
Okay.
if the person is manufacturing for his own purpose,
Okay.
it is allowed. But for sale, for the others, it is not allowed by the FSSAI, by the Ayush, by any other authority.
Okay.
Secondly, Ayurvedic practitioner can manufacture for their patients only.
Okay.
They are having the leverage to manufacturing practices, and actually they do it.
Yes.
They are having their own mortar and pestle, and they are trying to grind their mixture or trying to look up. So there is, but most of the time for the sale purpose, it is not allowed. If such practices are happening in the market,
it's wrong. It's wrong.
It's wrong.
Okay, sir. Thank you very much. There is one more question from Asma ma'am. Sir, please explain regarding the scope of the nutraceuticals in generic market.
Actually, there is a lot of scope what we are trying to look out right now. And after the COVID pandemic, the nutraceuticals have gained a large attention from each and every. When you are saying about the generic market, as such, in case of nutraceuticals, there is no generic market right now. And if you are considering about the generic market when you are saying the pharmaceuticals, no, still not, because we are there is no differentiation between the generic market or say about the pharmaceutical like this.
Okay, sir.
Hello.
Ma'am, yes, please.
Yeah. Thank you, Dr. Gilda, for a very elaborate talk. I just wanted to know whether, like, there were many Ayush Kadas and golden milks which are available in the market due to the COVID pandemic. So whether these things they come under nutraceuticals and are regulated by FSSAI, or they come under food purview only?
Hello, Gilda, Dr. Suhit.
Ma'am, I think so. Is it? I was not audible properly. So can you repeat, please? I think so. You are talking about the Ayush Kada.
Yeah, there are a lot of Ayush Kadas and golden milk
Yes.
powders in the market. and they are like sold as food items, I guess, under the FSSAI license. So they don't have to face any regulations from the FDA, or like it's okay to be sold under food.
They has to be get their registration under Ayush. They have to get their approval from Ayush first. It is not actually the okay case for the FSSAI. FSSAI doesn't recognize such a combination. If you are talking about the turmeric latte or turmeric milk, the golden milk, it is okay. It can be approved by the FSSAI. But in case of the Ayush Kada, it has to be prescribed only and only by the Ayurvedic practitioner. One thing. Secondly, the product has to be approved from Ayush department. Because the combination, because you must have heard about in the news that the Malega pattern or something like that, the Kada they have prescribed, they are having more side effect.
Hello, participants. Dr. Suhit will rejoin in a short while. Participant delegates, if you have any question, kindly type it in the chat box or mail us, and we will get back to you soon.
Am I audible, ma'am?
Yes, sir, you are audible.
Yes. Okay. Thank you.
Last question.
One more question. Just a minute. There is one more question. Just started manufacturing Unani formulation. Initially, don't know about the turnover. How one can apply for FSSAI registration or license? किसी ने यूनानी फॉर्मुलेशन का मैन्युफैक्चरिंग शुरू किया है.
Okay.
उसे FSSAI रजिस्ट्रेशन और लाइसेंस का पता करना है. He wanted to know more about this registration and license.
So they can go with the state license first, and then they can have the Unani license. First, they have to go with the state license from the FSSAI.
Okay.
And after that, they can approach
Okay, sir.
the Ayush Mantralaya. So they will get, they will direct it to the FDA, and then they will have, they can manufacture the Unani medicines.
Okay, तो पहले state
State.
license लेना है.
Yes, sir. Local
Then
license authority होते हैं.
Okay.
So जो FDAs होते हैं local authorities, वहाँ पे आपको application file करना होता है. And after that, you will have an inspection.
Okay.
Documents line up.
Okay.
So starting from the premises, starting from the dosage form you are going to prepare, what exactly the quality control test you are going to implement. They are not having the stringent norms, but you have to put it. So they will not ask you to put up or set up a testing laboratory, quality control lab, but they will ask you to sign up a MOU or have a the lab. You can sign a MOU with that lab, and you can get the quality control test carried out there. So this is the basic difference, and it is far easy when you are comparing with the pharmaceutical industry.
मतलब अगर खुद की लैब नहीं है तो जिसकी एस्टैब्लिश लैब ऑलरेडी है उसके साथ एमओयू करके वो कर
सकते हैं.
यस.
Again, definitely loan license के बारे में मुझे बताना था, but the time constraints and focus बहुत अलग चला जाता है. So most of the time what happens कि मेरे पास dosage forms होते हैं, मेरे पास capacity भी है, but मेरे पास प्रोडक्शन करने के लिए सिर्फ 2 दिन का ही प्रोजेक्ट होता है, काम होता है, and rest of the 28 days मेरे खाली चले जाते हैं. So I can't work on those days because मेरे मार्केट के कैपेसिटी से मुझे जितना बनाना था मैं 2 दिन में बना सकता हूँ.
Okay.
Rest of the 28 days मुझे मेरे ह्यूमन रिसोर्स जो भी है, मेरे पास काम करने वाले लोग हैं, each and every facility I have to run that thing.
Yes.
And blankly I can't run. So लोन लाइसेंस अभी ये ट्रेंडिंग में चल रहा है कि हर कोई पर्सन क्या करता है, जिसको मैन्युफैक्चरिंग करना है तो वो जिसके पास फैसिलिटी है उसके साथ एमओयू साइन कर लेता है एंड ही कैन वर्क दैट. क्योंकि उसका तो 1 दिन का काम होता है. So he get the product manufactured there, he come up with the product ready to be dispatched, and वो वहाँ से वो dispatch कर लेता है. So in that sense you need a loan license for manufacturing.
Yes.
When you don't have any type of manufacturing facility even. Only thing in that case you must have the marketing license.
Okay.
That is the most easy, and that comes around within say around 10 to 20,000 rupees only.
Yes, sir.
There is no need to establish a lab or say the premises.
Okay, sir. Any more questions? So no more questions from the audience. So we are concluding the session.
Yes.
Thank you, sir, for this elaborate talk. I would now request Dr. Sharbari Hardikar ma'am to propose the vote of thanks.
Good afternoon, everybody. It gives me an immense pleasure to extend the vote of thanks on behalf of the convener and the coordinators of today's session. On behalf of MCE Society's Allana College of Pharmacy, Pune, we express deepest sense of gratitude to Dr. P.A. Inamdar, President, MCE Society. Thank you very much, sir, for your continuous encouragement and support to arrange the programs and lectures under Entrepreneurship Skill Development Cell activities. We also convey heartfelt thanks to Dr. Suhit Gilda, Managing Director, Dr. Gilda's Nutrition Satara, for his very informative and motivating session. Thank you very much, sir. We are fortunate enough to listen to you today. We thank you for sparing your valuable time for us in spite of your busy schedule. We express our sincere gratitude to guests of honor and office bearers of MCE Society Mrs. Abeda Inamdar Madam, Dr. Latif Makhdoom, Professor Irfan Sheikh, and Professor Muzaffar Sheikh. We are also thankful for the technical support provided by Mr. Amin Sheikh and team, Mr. Ramiz and Mr. Imran Beg in particular. We, the coordinators of the session, are thankful to the principal, Dr. Kiran Bisay, for her guidance. And she is always instrumental to organize the events, contributing to the overall development of the students. Now, last but not the least, we are thankful to the participants for their overwhelming response. More than 200 delegates attended today's session. Once again, we thank you all. Have a nice day ahead. Now I request the attendees to make the video on and stand up for the national anthem.
हे नाही येते. अरे हे ऑडिओ ऐकून
Yeah, we will sing. No issue.
जनगण मन अधिनायक जय जय भारत भाग्य विधाता पंजाब सिंधु गुजरात विंध्य हिमाचल यमुना गंगा उच्छल जल तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा। जनगण मंगलदायक जय हे भारत भाग्य विधाता जय 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 हे जय हे जय जय हे।
जय हिंद.
Thank you all. Thank you very much.
Now let's call it a day. Dr. Suhit. Dr. Suhit. Sir, very nice session.
थँक्यू मॅम.
खूप सुंदर झालं
येस.
हे आणि सगळ्यांना म्हणजे बेनिफिशियल हे झालं.
थोडस टाइमचा हे झालाच की मागे पुढे झाले, बट नेक्स्ट टाइम नक्की.
मॅडम
छान हे झालं.